Fellowship of the Great Physician welcomes you to House Call. Our hosts today are doctors of chiropractic, Dr. Gerald Bala and Dr. Richard Jensen, who is also a board-certified acupuncturist, practice independently in Shoreview, Minnesota. Let's join our hosts for today's program that will assist you in your quest for optimum health and well-being.
Welcome to House Call. I'm Dr. Gerald Lala.
And I'm Dr. Richard Jensen.
It's great to have you with us again today. This is session 2 of osteopenia, or osteoporosis and osteopenia. And we're happy to have you with us. We're going to continue on with the material that we have presented, and Dr. Jensen is going to begin with a wonderful x-ray of the lower back and pelvis, right?
That's right, Dr. Lala. So first of all, what we have here is, you want to take a complete history when you're taking care of somebody, and one of the things that you want to ask is, do you have a history of bone fractures? Reason for that is if you look at this X-ray, you can see where they've had a lot of problems here in the low back with not only calcification and so forth that's run amok, but they've had a history of bone fractures primarily in the femur, and this is really one of the first places that fractures occur in osteoporosis. Due to the fact that there's an empty space within the bone right at this neck of the femur, that where if you demineralize there's nothing there, and it breaks once you put pressure on it. So a lot of times the elderly, when you have a history of breaking a hip and then falling down spontaneously, or falling down and breaking a hip, it's usually that you broke the hip and fell down due to the weakness of the bone. So then, what do we do for that? We want to look and make sure, one, is do you have a family history of osteoporosis? And which family members could it be? Heredity plays a significant role, and if you look here, this is a gentleman on this slide that has osteoporosis. And so it's not just a female thing. Gentlemen get it also, and you can see where this particular person has had fractures due to spinal weakness up in the upper back, as well as a lot of calcification problems in the low back, where if you looked at session 1, we looked at the low back there with calcification of the abdominal aorta, so you know there's something going on with forming bone. You want to be careful. Beware of those who treat the spine and put pressure on the spine or rib cage or extremities without recent x-rays. You want to know because unless you look, you're guessing. So to see is to know, not to see is to guess. One of the other things that you might want to have done is a yearly bone density test. And so what we're going to do is go into what does that mean. Bone density test is really looking at bone mass. And it's usually the highest in the early or mid-30s is where you have most calcium in your bones, and then thereafter you start to lose it at about 1.5% loss yearly. Now what does that mean? As we look at our bone density scores, there's a thing called a T-score. And if you look at that T-score as if looking at a thermometer, with the more negative the numbers being the measure of a lack of bone mineralization. So once you get below 0, you're actually going down below. And a bone density scan reveals this T-score. It's the value used to indicate the level of bone health as compared to a healthy young adult of the same sex. So they are comparing it male to male, female to female at a healthy young age, okay? For postmenopausal women, a score down to -1 is normal. This is like looking at a -10 degrees Celsius or Fahrenheit or whatever. It's negative, but it's deemed as normal for that age. A T-score between -1 and -2.5 is classified as osteopenia or low bone density. That means that you're having a reduction of bone mineral density within your calcium mineral density within your bone. And any T-score that's below a minus 2.5 is considered osteoporosis. Now, one of the things that you might want to look at is that there's a difference between T-score and Z-scores. T-scores, when you're looking at 34% above and below the average bone mineral density. That's BMD, is the first standard deviation. So if you're looking at the different color bars there, as you go to the left, you have, that's towards the negative numbers. And the dark blue goes down to minus 35%. That's a standard deviation. Also, to the +1, which is the light blue that's on the right side of the uppermost part of that curve, that's also a standard deviation. So what you're doing is you're covering 34% above and below, which is usually about 70%, just below 70% of the population will be within that area. Then as you go to standard deviations above or below that, what we find is that the risk of fracture increases 2.5 times as you go between the -1 and the -2 for every standard deviation. So if you're looking at between -2 and -3, that would be not minus 2.5 times, but minus 5 times. Or I should say, it should be 5 times greater chance of bone fracture than if you were within the first 34%. Now, Z-score and T-score. If you look at the shaded area, at the top part of this shaded area right here, this is a standard deviation, okay? And so as you look at this, this is what normal bone mineral density would be, and it would follow this line across here. And so normal T-score here is at a -2, okay? But as a Z-score, or at a -2.5 at this point for a T-score, but a Z-score would be a -5. The difference between this is where T-score is in comparison to a young, healthy adult of the same sex. A Z-score is a specific comparison to somebody that's of your age, in your race, in your gender, and what normal is in that. So how you compare to people that are similar to you to see what your bone density would be. So it's very important to know both your T-scores and your Z-scores. T-score shows you how much more at risk you are for fracture, and Z-score is how you compare to the other people of your age. Okay? So let's go on.
Now
Dr.
we're
Love?
going to look at just a brief discussion of what osteopenia versus osteoporosis. Osteopenia is the initial stages of bone loss. Osteoporosis, of course, is the advanced stage of bone loss. Now we're going to bring up a slide to show you what normal posture is and what it should look like and what happens when those bones start to collapse. So on your far left, we see an illustration of the normal curves. We're supposed to have 3 normal curves in the spine. We look at it from the side, a slight sway in the neck, a slight sway in the lower back, and a slight humping in the mid-back. But if osteoporosis or osteopenia comes in, then the center section you'll see the head goes forward, the mid-back goes backwards. We call that a thoracic kyphosis, and then they'll develop excessive lumbar lordosis. And then when it goes further, they begin to really lose a lot of height, and those curves are accentuated. Now the next slide shows an individual that's a classical case. See on the left, we're looking at this gentleman from the side. You can see he's in the final stages of osteoporosis. His x-rays showed that there were already several collapsed vertebrae, had been to chiropractor, massage therapist prior to seeing us, as well a medical doctor, and nobody had done a bone density study on him until we took some x-rays of him and reported that to his medical doctor. Now the next one here, we're looking at the x-rays of this individual. On the far left, we're looking at the mid-back. You can see his thoracic area, his ribs, lung tissue, or lungs, and we can see that spine is really dramatically curved, first in the upper back to the right and then dramatically to the left We also see his aortic knob or arch of the aorta there that Dr. Jensen is highlighting for you, that it has put a great deal of stress on his aorta, and that's caused him to have high blood pressure. He doesn't have any defect in the heart. It's because there's so much stress on the aorta due to the spine being out of alignment that causes high blood pressure. And then when we look at to the far right, your right, we see how humped forward he is. Now we'll look at another x-ray. Here's where a hip has been replaced because the bone had spontaneously fractured, and they said to the orthopedic surgeon, should I take some calcium? Yeah, it'd probably be a pretty good idea, and that was about it. That doesn't make any sense at all. Now we're going to take an internal cross-section of difference between osteopenia and osteoporosis. So on your far left, we see the trabecular pattern. The bone in the case of the femur there is like the span of a bridge, supposed to be good and strong. But now if we look at the center picture, that's the femur. Dr. Jensen is going to show you the head of the femur. He's going to outline that for you. That fits into your hip socket. Then he's going to show you the neck of the femur where fractures most commonly occur. Then up on the top, that little mountain peak is called a tubercle, where muscles and ligaments and tendons attach. And those dark black areas that we see, they look kind of like spongy, that's osteopenia. Now, if we go to the far right, those dark areas have increased. That's what osteoporosis looks like. Now the next, yes, Dr.
One
Jensen.
thing to look at this, the reason why we have so many fractures through this area is that inside of these bones, there's both protein, kind of strings. It's kind of like when you're building bricks in the old movie, The Ten Commandments. They talked about building bricks with mud and straw. Well, the protein is the straw, and the calcium is the mud. And so as the mud goes away, or the calcium gets depleted, we end up with just the protein here. Well, when there's no calcium in there and there's no protein, like in this spot here, this becomes a weakness in this bone that's natural to everybody, that it would occur right there, and that's where you're finding most of those fractures taking place. And that's why when you have a bone mineral density test, they're looking primarily at this spot as one of the spots that they check.
Now we're going to look at another slide of a cross-section of 3 vertebrates, an illustrative example, a model. We see at the center where it's kind of red, that's nice and healthy bone. Below it is the disc. And then the next vertebra, there's osteopenia. See that bone structure is starting to weaken, to become porotic or sponge-like. And then at the bottom, we see that's osteoporosis, or an illustration of it where the bone is actually collapsing. Then we're going to get another example of that by looking at a sponge. It's a pretty healthy sponge, but we can see a few holes in it where osteoporosis is beginning to take place. Those are those little black areas that you see on the sponge. And Dr. Jensen is illustrating those for you. And then the next illustration is where it turns like into osteoporosis, where it becomes very porotic. Now the next slide shows a different sponge. There's some healthy areas. If this was a magnification, a microscopic magnification of bone, where the bone has got good trabecular pattern, good density, but there are some beginning areas of osteopenia. And then this other slide that we're going to look at now would be the sponge where we see definite porotic holes there where it has advanced into osteoporosis. Now the sponge doesn't have osteoporosis, but those are illustrative examples. Now Dr. Jensen is going to talk about some other degenerative disorders related to other bone degenerative disorders. Dr. Jensen.
Thank you, Dr. Lala. Well, when we're looking at disease, a disease is dis-ease, and what adds to that dis-ease is certain symptoms, a constellation of symptoms that are around that make it easier for us to categorize what's wrong and find what the problem is, and hopefully help change what's wrong so that you heal from this particular problem. One of these degenerative bone disorders would be rickets. Rickets is actually osteomalacia of the very young. It's due to a deficiency of vitamin D, in which you're not, vitamin D helps us place calcium into the bones, and as well as absorb it through our intestinal tract or through our diet. And therefore, we find that children who are very low on vitamin D end up with rickets, and it's categorized by that they have swelling at the growth centers of their bones. So osteomalacia is the same thing as that, but only in the adult, where we don't have the active growth center, so we don't have that swelling, but it's still bad for that. Arthritis, which attacks the joints. Osteoarthritis, also there's an erosion of the joints and the bone around it, and rheumatoid arthritis as well, which is depicted by inflammation. Actually, inflammation is part of osteoarthritis also, just different metabolic problems with that. It's not just overuse, it's the inflammation that's unchecked. So then, building strong bones. What we'd like to do is find a good food supplement for that. Building strong bones actually affects the joint, the actual cells that are part of that. The different cells that we use for building bones, there's two kinds here. There's osteoclasts and there's osteoblasts. And the osteoclasts, what they do is they tear down bone. They tear down bone as it reabsorbs or dissolves the old bone away. And then the osteoblast comes back and rebuilds the bone. Now, the thing is that we usually have osteoblasts that are building this bone around them, and then those osteoblasts can turn into osteoclasts. And the thing that changes that is inflammation. So that's what triggers the change of an osteoblast into an osteoclast of the same cell, just at different stages of each other. And that's how we can see how inflammation can drive us towards osteoporosis. Estrogen also retards the reabsorption of osteoclasts. Progesterone stimulates the formation of new bone or stimulates the osteoblasts in that regard. So when you're going to create new bone, you want to give it the necessary raw materials for that. So we're looking at a good bone food supplement. And those bone food supplements should be a pharmaceutical grade and consist minimally of one of the best things is the right calcium for you, and a very absorbable form of that calcium is microcrystalline hydroxyapatite. It's actually the right crystal structure for the bone. It's the same kind of crystal structure that's found within your bone. You also want to have phosphorus, magnesium, zinc, and the fat-soluble vitamins of A, D, and K, as well as the water-soluble vitamin of vitamin B6 to help build those strong bones and build them a little bit easier. So many people take calcium, but it isn't helping their bones. And why could that be? If the calcium is the wrong type, say calcium carbonate is really hard for it to digest, really hard for the body to assimilate that into a bone. And so the body can only absorb about 10% of calcium at one time. We're looking at, as our gastrointestinal system decreases in the acid that it puts forth, we absorb usually between 10 and 40%. And as we age, that gets less and less. So we're tending more towards only 10% of calcium absorption at any one time. Most calcium is not a complete bone food, such as that microcrystalline hydroxyapatite. And most does not match the bone matrix, as microcrystalline hydroxyapatite also matches the bone matrix. Now, the body and calcium. The body's innate intelligence knows the difference between good and not so good. It knows which form of calcium is best, and it rejects those that are not biologically appropriate, such as sometimes they put out a form called dolomite, which is basically like eating chalk, and it's not very well absorbable. It's not readily bioavailable for us. We are destroyed for a lack of knowledge. If you're looking at the vitamins that have the most amount of contaminants, number one is your fish acids or your fish fatty acids, such as the omega-3 fatty acids. Number two on that list is your calcium supplements. So most of these contain toxic metals, unless they've gone through some type of process to get rid of those toxic metals. Most do not contain proper biochemical ratios, such as if you have too much calcium to magnesium, they have the same binding sites within the intestinal tract, and therefore if you have too much magnesium, it's clogging up those receptacles so that it's not absorbing all the calcium. So you need to have that proper biomechanical ratio. Most do not have microcrystalline structure to them as well. And many people are allergic to some forms of calcium, such as if you're allergic to one of the foods that most people are allergic to is milk and or dairy products. And if that's where you're trying to get your calcium from, if you're allergic to it, you're not digesting it very well because your body is trying to defend itself against this toxin, and it's pretty much trying to bar off the absorption of this thing by putting more mucus in there and trying to block its absorption. So, with all that, a lot of times people can look at this in a negative way. And we want to tell you that not all is bad. Not everything is going wrong in your life. You don't necessarily have osteoporosis or osteopenia. We want to try to help that trend in that you tend more towards health or ease rather than dis-ease. And in that case, the gracious life of God flows within you, and it brings healing to every fiber in your body, and that's what we would hope for you. That's in the Bible. It's John 6, verses 63. So let's talk a little bit more about calcium, Dr. Lala.
There are 7 basic types of calcium in nature. You see them listed before you. The one that Dr. Jensen has been addressing is called MCHC, or microcrystalline hydroxyapatite. Then calcium carbonate, calcium citrate, calcium orotate, calcium gluconate, dolomite, and bone meal. So if the least absorbable forms are bone meal, dolomite, calcium gluconate, calcium orotate, calcium citrate, then calcium carbonate, and microcrystalline hydroxyapatite. Now, as Dr. Jensen has said, and I will reiterate, microcrystalline hydroxyapatite is the most absorbable form of calcium, containing also not only calcium, magnesium, phosphorus, but it is a full spectrum of trace minerals in natural ratios. In other words, the way God created the body, everything has to be in proper ratio. So, for example, for every 3 milligrams of calcium that we should ingest, we should only be on averaging the ratio to calcium and phosphorus would be 3 calcium milligrams, 3 milligrams of calcium, and only 1 milligram of phosphorus. And they don't care. The government doesn't regulate if they have those in proper ratio or not. Plus, they should be naturally occurring protein and organic factors. Naturally occurring protein and organic factors, meaning about 22 to 28%, including the growth factors that include amino acids and type 1 collagen. Now let's take a little specific look at microcrystalline hydroxyapatite. If it is a pharmaceutical grade, not the typical kind of food grade that's sold in drugstores, health food stores, many chiropractors, many nutritionists, many independent distributors, because generally only licensed medical doctors, licensed chiropractors can utilize and dispense pharmaceutical grade. So it is pharmaceutical grade based on that it's cold process, it's dicalcium phosphate, it contains trace minerals of phosphorus, contains protein, type 1 collagen, bone amino acids, and organic factors. Continuing now with that, then it retains a very microcrystalline, very small structure. It is assayed of microbial and heavy metal contamination. In other words, they have had independent laboratory analysis that has proved that it is the lowest amount of any bacteria, viruses, or heavy metals. It is obtained, they don't want it obtained from cattle, or if they do take it from cattle, it is proven to be free of bone of mad cow disease and raised on a pesticide-free food or feed. It is purity certified and organic. Calcium carbonate, Dr. Jensen is going to look at you with very briefly. This is the second most form of absorbable calcium.
Thank you, Doctor. So calcium carbonate, it's 40% calcium by weight. It's not a complete bone food. It's just calcium. It doesn't have all the phosphates and things that go along with it. It's not in a crystalline structure. and it is not well absorbed. It's very hard for your body to liberate the calcium from that. Antacid effect with a loss of acid and alkalinity. So it has an antacid effect. Gee, I wonder what you usually find this in, what type of supplement is out there that people are taking it with that helps take care of acid in the stomach. Predisposes people towards alkaline balance and digestive issues. And so you're looking at that on this slide in comparison to microcrystalline hydroxyapatite, that's where it has, where the first form, the MCHC, has the trace minerals. It has the type of collagen that's needed. It has organic factors, and it has the amino acids where calcium carbonate just doesn't have any of those because it's pretty much just calcium. Okay, then calcium citrate. Calcium citrate is actually a little bit better absorbed. It's due to the acidic nature of the citrate that's bonded to it, and our body needs acid to liberate calcium, and so this delivers that with it. It's only 22% calcium. It's low in the elements of calcium and phosphorus together. It's reasonably well absorbed. Like I said, it's due to the acid concentrate from the citrate. But it's not a complete bone food, and it's low in trace minerals. So then the next one, calcium orotate, Dr. Lala.
Calcium orotate, you see the suffix there, ATE, means that it's chelated, that they've put it together so that it makes it a little bit more absorbable. Generally, it's cold processed. It's dicalcium phosphate. Contains some trace minerals, phosphorus, protein, type 1 collagen, some bone amino acids, some organic factors, and but it is low in calcium itself. It is not a complete bone food. It often does contain milk and or yeast, so if people have yeast problems such as candidiasis or some kind of fungus infection or an allergy to dairy products, that product is contraindicated. Very often its sources are from molasses, starch, sugar, and whey, of which many people are allergic to. Then there's calcium gluconate. On the far left, we compare it to microcrystalline hydroxyapatite. On the far right, we see that it's only 9% calcium. It's not a complete bone food. It contains corn, and many people have corn hypersensitivities, and it'll cause people to take too many tablets. Now, Dr. Jensen?
And it's not a good form for people who have diabetes.
It's not for anyone with diabetes. And Dr. Jensen, we're going to look at dolomite, the next one. And you compare on the far left, microcrystalline hydroxyapatite. Look at dolomite, it's poorly absorbed. It can be contaminated with heavy metals, contributes to alkali, what we call alkali syndrome. And then lastly, bone meal, which is further junk, but they sell a lot of it because it's cheap and they got a high markup in it. The old American way, whatever you do, produce something cheap so you can make a lot of money, charge a lot for it. And there are just people being conned by other people. It is a con job because when we don't know, we can't manage. But it is heat processed. It's taken from calcium carbonate, has no trace minerals, has no phosphorus, has only a trace of protein, a trace of type 1 collagen, bone meal acids, just a trace. Its organic factors are 0. And where do they take it from? Old cow bones. Now, let's look here for a minute. We are, in fact, destroyed for a lack of knowledge. We really are. And I realize that some do and some don't, some will and some won't. Some people aren't going to listen and take good, solid advice. But your body is the only body that you are ever going to have. It's the only body that you're ever going to have. Therefore, if a boat or a fishing house, a snowmobile or a condo or some other thing or a car or whatever, if they're a higher priority than having good diagnostic testing that is going to give you inside information on what your body is doing.
House Call has been brought to you by the Fellowship of the Great Physician. For further information, telephone us in care of Dr. Lala or Dr. Jensen at 651-484-8521 or visit our website at housecalltv.org. Thank you for joining us today.